I'm Arvind Peratur. I'm the clinical head of pulmonary and critical care as well as sleep services at Amrita Hospital in Kochi, Kerala. The global trends in sleep apnea have been on a rise for the last several decades. Um, if you really look at the prevalence of obstructive sleep apnea, it's about 4% in men and about 2% of women across the globe. And this tends to get worse as people get older. And more recent studies have shown that there's almost about 10 to 12% of patients across the globe, or people across the globe, who are at risk for sleep apnea related comorbidities, which includes other cardiovascular diseases and diabetes and stuff like that. And one of the biggest concerns of untreated sleep apnea is about 30% of all the motor vehicle accidents across the globe is related to sleep disordered respiratory breathing issues. The Indian scenario is actually is up and coming now, in the sense we have even though we've been treating sleep studies patients with sleep disorders for about 3 decades across the globe, mostly in India and especially many of the developing countries. It's only been in the last 10 or 20 years that things have been, the awareness is slowly increasing. The more recent improvement in economics in the developing countries has resulted in increased obesity. Sleep apnea is associated with obesity, and as the obesity worsens, you have a higher risk for sleep disordered breathing. And the bigger problem in India now is that the kids are getting into trouble. The school-going kids, the percentage worldwide is about 5% of school-going kids are at risk for sleep disordered breathing, and it's an ongoing worsening problem, especially because the awareness is not as much among doctors as well as physicians and as well as patients in India. In India, like I mentioned, the problem is awareness of sleep disordered breathing among physicians as well as patients. The other problem we have is we do not have a good system of education for physicians as they come out of training. And as the physicians are not well aware of the amount of complications that sleep disordered breathing can cause, it has resulted in underdiagnosis of obstructive sleep apnea, and if the patients are not aware, it translates to overall population not getting a good understanding of the disease, which is probably the most important thing, because not only diagnosing is an important part, but ongoing treatment is an issue. In a developing country like India, the issue is with the cost of not only testing but also treating. The typical treatment for obstructive sleep apnea is with the CPAP machine. Unfortunately, CPAP machine, the cheapest one would cost you about 25 to 30,000 rupees, depending on where you go, for what kind of a vendor you go to. And that is something that is upfront a large amount of cost, especially for some patient who doesn't understand or does not have symptoms which he recognizes as is a big problem. At Amrita, what we are trying to do is set up a state-of-the-art sleep lab, which first will appropriately work up such patients. Our hope is that our postgraduates, as they're training through here, they see what the extent of what amount of workup it takes to really understand the disease. The second part, which is, many of the centers do it, but the most important part of treating specifically obstructive sleep apnea is that there's got to be continuing care. Just diagnosing the disease and giving a patient a sleep machine is just the beginning. It's not the end of it. We have patients come back after they have done that, after they have gotten machine, to really follow up and see that they being compliant with the machine, they are actually using the machine. The advantage in the West is that the insurance will not pay for the machine or pay for all other CPAP related supplies on a regular basis if the patient is not coming back to the physician to get this compliance documented. In India, we don't have, because it's mostly self-pay. The patients usually try it for a bit, and they don't think that if they don't like it, they don't come back. And then because anyway, it's going to be there's going to be some recurring costs, and they'll say it's just a bad apple that they picked, and they started the CPAP treatment. But what we are doing is we come back, there is smart cards or chips that go into the machine. We actually analyze it, and we actually educate the patient to really understand about their disease and the important thing about risk reduction of cardiovascular disease like strokes, heart attacks, metabolic syndrome, obesity, and most importantly in our middle-aged people, decreasing the risk of motor vehicle accidents with ongoing treatment and being compliant on treatment and overall improvement in quality of life. The future is now. I think we have to really work on improving our CPAP machine. One of the problems that's happening is the CPAP machine is still pretty crude as far as the treatment. And we have come a long way compared to the 80s when we started this CPAP treatment and stuff like that. But the machines have become more comfortable, and comfort in the machine is probably one of the major drivers for improved compliance for the patients to continue treatment. I think what's going to happen is we're going to come up with more innovative machinery, more innovative masks that will be more comfortable for the patient. There are some medications in the pipeline that are being almost in phase 3 trials to get approved. There are some other methods, some innovative surgeries that are being considered, as well as some pacemaker kind of stuff that is being looked at, and some of them are also in the market, not yet in the Indian market yet, but I see that definitely being one of the major drivers in the next few years.